Ready. I'm ready. Let me know.
Okay, Molly, you're going to be recording this, correct?
Yes, recording is started.
Great. Hello, everyone. My name is Brian Waters. I'm an account executive here at Bales & Associates. Welcome to today's Informative Friday presentation. Today's topic is best practice for a clinically integrated supply chain. Before we get started, and if you're not familiar with Bales, I'd like to take a second to tell you a little bit who we are. We were founded back in 1995 by Jamie Bales. We're located roughly 20 minutes south of downtown Pittsburgh. We've been part of the partner community since 1997. We offer full human capital management, finance, and supply chain management offerings that also includes the technological components. We have deep roots in Lawson and Infor implementations. If you check us out online or look us up on the website, you may see some familiar names that we've done work with, and we have a bunch of referenceable clients that we could provide anytime down the line. We were involved in the development of the Infor Cloud Suite and actually provided training for all the Infor partners. Our average tenure of our consultants is 15 plus years. And a little over, 2 years ago, we became a subsidiary of Nordic Consulting. Today's session is being recorded, and a link to the recording will be sent to all registrants. If you're not registered but would like to receive the link, please email Molly Velasco at bales.com to request a link. Again, we would like to thank you for joining us today. Let me turn it over to Jason. Jason, it's all you.
Hey, thanks, Brian, and thanks, Molly, and thanks everyone for joining today. Just a quick intro on myself. Make it forward. My name is Jason Anderson. I'm a director in our performance improvement advisory services practice at Nordic Consulting. So this is my first Informative Friday presentation. So thanks for having me, and I'm excited to present this topic to you. My background is actually not as much in the Infor or ERP space, but more in the Epic EHR implementation and optimization space. I've done a lot of work in the Periop space in regards to that. So I've had a lot of tie over with supply chain and material systems and integration between those systems. So excited to go through this topic with you today. Real quick though, just a quick overview on who Nordic is for those who don't know. So Nordic is a global advisory services firm consisting of our legacy Nordic group, Bales, and then companies in Canada, health tech, and then Tasman and hygiene in the UK. We've got over 1,400 professionals globally with deep clinical expertise, extensive technical knowledge, advisory expertise, and proven operational capabilities. And we provide a broad range of consulting services, including strategic advisory, digital and cloud initiatives, implementation and support, and enterprise technology transformation. Our over 500 clients trust us. Oops, I'm jumping ahead here. A little sensitive mouse. Trust us to help them identify and focus on their most important priorities and consistently deliver business-changing impact, as highlighted by our many awards and in class and other industry publications. So this should cover the intros of who we are. So this might not be the traditional presentation you've seen on an Informative Friday. We're not going to dive super deep into Infor functionality, although I want to keep it Infor-centric, but really want to provide you with more insight into the bigger picture and downstream impacts from what you might do on the day-to-day in the supply chain world, and really focus on how your organization can leverage ERP and EHR integration best practices to create a clinically integrated supply chain to optimize care outcomes, drive down costs, and improve revenue capture. So we're talking to you about this today because we think it should be an area of great importance to healthcare organizations dealing with what we're referring to as the big squeeze. So it's declining margins, rising labor and supply costs, supply chain shortages and logistical challenges, physician and nurse burnout, sicker patients from long COVID or coming off of COVID-related care delays, and all these things are putting a lot of pressure on healthcare organizations. And we think this is one lever that they can pull to help relieve some of that pressure. So it's going to be me kind of talking through the whole thing here. So I'll try to pause throughout and see if we have questions as we go. So to start, let me define what we think of as a clinically integrated supply chain. So first off, it's a cross-functional, interdisciplinary partnership between supply chain, operations, clinical, and others to help maintain a focus on delivering high quality care while achieving the best outcomes at the lowest cost and with minimal waste. It's an end-to-end process, so starting from sourcing and procurement on the supply chain side, all the way to tracking of clinical and financial outcomes on the clinical side. It's a data-driven approach to help drive value-driven decision-making processes. And all this, of course, to support physicians to help better serve the patient and provide them a more personalized care experience with the aim of keeping them and getting them healthy. So that's our view of a clinically integrated supply chain. So why do we think this is an important topic to cover with all of you now? So I want to run through a few stats that highlight the current state of the supply chain. So the first one being, so the total supply chain cost to serve a health system averages a little over 37% of the total cost of patient care. So often this is second just to labor, potentially more in high acuity or case mix areas. And recently saw a stat, with inflation over the last few years, these costs have increased 20 to 30% since 2019 or 2020. Between 59 and 83% of organizations have reported delays or increased lead times acquiring supplies since the onset of the pandemic. So many of you are probably familiar with that, lived through that, so more challenging in getting the right supplies and getting them on time. And then a poll, survey by Cardinal Health a few years ago, that despite respondents rating their supply chain processes as good, 1 in 4 hospitals have seen or heard of an expired product being used on a patient, and 18% have seen or heard of a patient being harmed due to the lack of necessary supplies. More than half could recall a time when a physician didn't have the product required for a patient's procedure. So all this to say that, anecdotally, answered as good, but the data and other responses would suggest there's still challenges and concerns to the patient. But where are there opportunities? A 2019 Navigant report identified over 25 billion in savings opportunities for hospitals across the country in reducing variation and waste. Would gather that number is probably even higher now. And then 62% of hospitals increased spend on supply chain applications, and 64% of executives called their cloud-based supply chain management applications business critical. So there's a burning platform right now. Leadership is engaged, and supply chain and ERP systems is on their radar. So going back to our topic thesis statement, what this presentation is about, how can EHR and ERP integration help solve some of these problems and drive towards a clinically integrated supply chain? Well, first, integration can help improve care quality. So through tracking and tracing of implants from procurement through implantation, integration can enable a data-driven approach to evidence-based care, which will lead to more personalized care delivery aimed at improving outcomes and patient satisfaction. So, for example, clinicians can use predictive analytics with data collected from both the EHR and ERP to truly affect patient outcomes based on a myriad of factors: their health, their location, and past medical history, and help identify the right product for the right situation. Integration can also improve operational efficiency. So, focusing on the end-to-end process improvement and cross-functional collaboration, integration can help drive efficiencies across the supply chain. Additionally, it can help address clinician and physician satisfaction through improved documentation efficiency and helping to give physicians those data-driven metrics to support the value analysis process and that physician preference process. Integration can help increase and improve your revenue capture. So integration can help maximize supply and implant revenue through things like charge capture improvements, having a more integrated and standardized charge review process, and having a more focused strategic pricing process in the market. It's especially important today with mandates like price transparency and the No Surprises Act, where we need to be providing patients with an accurate representation of their financial liability. Additionally, I mentioned the big squeeze. So, hospitals really need to now more than ever have a handle on their pricing and charging and costs, and can do that through these focused revenue capture initiatives. And lastly, integration can help drive cost containment. So the goal should really be to reduce the total cost of care, and integration can help support streamlining inventory management processes, reducing waste, and reducing that variation through things like case costing and demand planning. With the EHR, we can also arm clinicians with cost information on the front end, which can help them drive decisions. So, having that transparency, they can address items more proactively and potentially selecting a cheaper but just effective alternative. So how else do we know that there's value in this EHR and ERP integration thesis? Because we've done it before. We worked with a multi-hospital system on a Periop of supply chain improvement process. They were experiencing financial loss in their OR due to a lack of integration between their Lawson system and Epic, and just a lot of mischarge capture opportunities. So we helped them with a myriad of things, both technical and operations, helped implement standard HL7 interface, conduct an item master cleanup, helped develop a integrated item master maintenance process across the different stakeholders, looked at preference cards and pick lists to clean those up, looked at the nursing workflow and documentation efficiency through barcode scanning, new opportunities for charge capture and perfusion, and then the supply chain back order process as well. And what were some of those results? I think, notably almost 10 million in annual, so recurring net new charges for perfusion supplies, a 6.5% increase in supply and implant charges per case, 37.8% reduction in daily returns to the OR, and 73% reduction in active surgeon preference cards. So I think the key takeaway here is that, our integration went far and beyond just, that technical component, but also looked at clinical and revenue cycle analysis to achieve those results that matter. All right, so kind of talked about why we think this is an important topic and that real results are achievable. So I want to get a little more into the weeds on the issue, on how to approach it and where you can focus to realize this value. So first, just taking a step back and defining the systems we're talking about, hopefully pretty high level, but kind of just intro you to some of the, Bales and Nordic brings technical expertise across both the EHR and ERP implementation and optimization. And you all know these systems are so critical now. A majority of staff at the hospital pretty much has daily interactions, if not more, with one or both of these systems. But typically these groups are operating in a silo, and we think it's critical to understand that end-to-end impact. So I don't think I need to tell this group much about the ERP system, but HR, supply chain, financial management, and that productivity tracking. But quick from the EHR side for those who maybe don't have as much exposure. I mean, it's really comprehensive of that patient focus. So it's your patient medical record. Anytime you're going to a doctor's appointment, an urgent care facility, emergency room, admitted for surgery, the information is being recorded, all that clinical information in the health record. It's managing scheduling and registration, so any upcoming appointments and managing that financial clearance. All charges that you incur throughout your visit are recorded here, and then billing to yourself and to the insurance company are maintained through here. And then all the data is used to help track those clinical quality measures that are needed for quality reporting and different incentive payments. So with the ERP being that source of operational data, and the EHR, the transactional data from a patient standpoint, it's really critical that these systems are in sync and fully leverage the shared capabilities. So what do our clients typically think about when we refer to integration? I think most commonly it's thought about in this technical context of sending data just back and forth between systems. So you've got each system passing key data elements back and forth to support workflows in each, and with Infor specifically, I've got the capability of using the clinical bridge to help standardize this process. So your item master being passed back and forth, replenishment and utilization, patient messages, And while all of this is needed, required, and a big piece of the puzzle, it's often too narrow of a focus when it's just looked at as an interface line item, especially as a part of an implementation, say. I don't think it fully has grasped the full scope of the work needed from an operational side to support the data elements and the workflow changes that come from this type of integration. So there really needs to be involvement from multiple stakeholder groups to review the key data items and understanding of what those upstream and downstream workflow impacts are. So just to highlight a few of those upstream and downstream impacts and to kind of drive the point home of the importance of integration, I wanted to walk through just a very high level surgical scenario to really highlight issues that can arise when integration is not addressed holistically. So we look at a simple scenario, a patient has an upcoming surgery, they were scheduled a day before or day of, items are picked for that via the preference card, patient arrives, goes through surgery, items are used, and then they're reconciled or utilization is tracked from a materials management standpoint, a billing standpoint, and from a patient outcome standpoint through post-operative tracking. Now, if that integration is not done well, both from a technical standpoint and sort of that process and workflow standpoint, a lot of issues can arise. So, scheduling and those preference cards are really on the front end and drive this whole process. So, if those cards are inaccurate or supply chain is unaware of the needs of a procedure, then there's potential for missing items, delays to a case, or even a cancellation of the procedure due to those inaccurate cards or scheduling. From a intraoperative standpoint, so documenting these items being used, nurses rely on things like the item description, catalog number, barcodes on the supplies, et cetera, to properly document. So if these items are duplicative in a system or incorrect, it can cause frustration at best, at worst delays, or just straight missed or incorrect documentation. And that, has potential to propagate downstream, where incorrect documentation can lead to inaccurate inventory counts, inaccurate billing, and really most importantly, inaccurate documentation against the patient's chart. So especially when a tool like the EHR is sophisticated enough to be able to track those implants and provide clinical decision support to prompt for things downstream, like if there's a recall an item or if the patient has an MRI upcoming, can alert that they have an implant that might want to change their procedure. So really even a simple scenario can highlight where integration or poor integration can have those cascading downstream impacts. All right, so how can you all avoid these pitfalls? So we've identified several leading practices that organizations can focus on to look beyond just the standard technical integration approach and try to address it in a more holistic way. So first, establishing integrated governance is a key first step, and it's going to help set a strong foundation for your clinically integrated supply chain. So you need to ensure that stakeholders from core impacted areas, commonly supply chain, clinical, rev cycle, IT, are constantly collaborating and understanding of that end-to-end process as it relates to supply chain. They also need to be responsible for setting guidelines, prioritizing needs and resources, and really establishing a vision and a strategy for how their clinically integrated supply chain should work. The next, governance is the foundation for that organizational strategy and vision. Having a plan to maintain data integrity is really a foundation and building block on the technical side to ensure that smooth operations are in place for the supply chains, clinicians, and revenue cycle users. So as I mentioned, just about everybody interacts with one of these two systems. So it's really critical that that underlying information is accurate, as it's going to drive downstream decision-making, workflows, automation potentially. So ensuring that everybody as a part of this group, has a clear understanding of data needs in all the systems, and then setting clear owners and policies and procedures to support this process is going to be key. And once those foundational elements are in place, these groups should really look to continuously optimize technology to enable process improvements. So whether it's leveraging existing functionality within core systems to their fullest capability, or looking at new or emerging technologies, there are a lot of opportunities to improve the inventory management process, or improve documentation quality or efficiency and revenue integrity. And lastly, once we've got all the end-to-end data from both systems, really focus on investing and developing reporting and analytics tools that can help inform those value-driven decisions around cost, care quality, and outcomes. All right, so I'm going to jump a little more into detail on each of these, but we'll do a quick pause and just see if there are any questions before I move forward.
There's nothing in the chat right now, but feel free, anybody at any time, to drop a question in.
All right, thanks, Molly. And that'll just be my tricky way of getting a water break in too. So first, I'm going to jump into discussing establishing integrated governance. So really, to be successful in this endeavor, breaking down silos across the organization is critical. Each of these areas, supply chain, rev cycle, clinical, IT, brings a different need and perspective. So all of these groups need to be in sync about how to provide the best care for patients and be financial stewards for the organization. So starting with supply chain, responsible for keeping critical supplies available to support care and operations. And obviously an abbreviated list here, but kind of related to the clinically integrated supply chain, helping to manage sourcing, procurement, inventory management, and ideally that item master maintenance process in the material system. The revenue cycle and finance group, so they're responsible for obtaining payment for the services provided by the health system. Their responsibilities include, managing those price transparency files I mentioned that patients rely on, developing a supply charging policy, and then maintaining that charge master, keeping markups in place to be in line with market factors, and then overall assignment of things like CPT and HCPCS codes to ensure appropriate reimbursement. Our clinical stakeholders, so most importantly responsible for care delivery and the safety of the patient. So they're the ones really providing that clinical care, doing the clinical documentation and tracking of items, often the ones maintaining preference cards, service line leaders within the OR, and then bringing those evidence-based practices that should be used to inform things like value analysis and weighing in on the efficacy of different items. And then lastly, the IT group, they're there to support all these groups by helping to maintain these core systems that all these others have come to rely on to do their jobs. So owning the core systems, the ERP, the EHR, and new implementations, upgrades, ensuring feature functionality and enhancements are in place, training end users on the system, maintaining the interfaces, maintaining the reporting and analytics platforms, and then helping to support evaluating and integrating emerging tech or additional technology to support their workflows. So again, all these groups, bring their own expertise that's critical to the understanding of the process. So getting them aligned is very important. So again, think about this from an implementation perspective, say an upgrade to the Infor cloud. In my past, I've often seen that additional rev cycle or clinical stakeholders are brought in too late to the project. So maybe in testing or potentially not at all. And then all these things come up about what their needs are and what's changing. And it leads to those unintended downstream consequences or scrambling late in the project to help accommodate their needs, and then having to address that post-live or then optimization or as a fire drill. So, again, it's really better to align these groups early and often, especially if you're looking at a larger project like an implementation or an upgrade. Just some additional areas where, this group meeting often and having that focus and governance over, a few key areas, in value analysis. So obviously this is a critical piece in sourcing clinical care items. So input from supply chain and clinical is needed to identify the items that are going to provide the most value from both a quality and cost standpoint. Item content management, in this new integrated world, each team is responsible for different data points to support that downstream EHR flow. So, historically, supply chain was responsible for kind of all the data points in the item master, but requirements for charging or clinical documentation, requires new input and potentially new data fields. And I'll provide some examples of those coming up, but critical to have all groups involved there. Maintaining system integration. So this group can be responsible for ensuring that all systems are sending the right data at the right time and that the right tools are in place to support the workflows. So they don't need to know all the technical ins and outs, but should definitely be aware of how systems are interacting with each other and what each of their group's responsibility is to maintain those. Other things, preference card maintenance, commonly owned by the OR, but definitely need support from supply chain and IT to help make sure they'll stay up to date, manage substitutions, drive accurate inventory, as again, those are often the starting point to the surgical process. Revenue integrity, a big one, in our opinion, this should really be the responsibility of all. At the end of the day, it's how hospitals and health systems can keep their lights on and continue to provide services. I think all parties do need to intentionally think about the impact of charging and how they can support it. And again, kind of think outside of their own silo to maintain revenue integrity. And then lastly, this group can focus on, clinical variance reduction activities and just generally continuous process improvement, working with physicians to provide that data-driven evidence to help reduce care variation, reduce costs, and general inventory variation. All right, so next I want to talk about maintaining strong data integrity. So again, after governance, key building block for success is having the right data strategy. So supply chain, clinical, and revenue cycle workflows, are all reliant ultimately on the item master, which is going to drive both manual and automated processes downstream. So gaps here can really lead to errors and inefficiencies if things are wrong. We've developed a few kind of core data integrity principles to help support this process. First being maintain a single source of truth. So ideally, this is your ERP system, and it's going to feed downstream to all others. Having that one source of truth to update and send to other systems is going to help reduce maintenance overall and any inconsistencies across the various systems. Second, make sure to eliminate duplicates from the item master. And even broader than that, I'd say probably have a clean item master. So I'm sure you've all experienced this over the years. The database just tends to get messy. So an item master cleanse is really an important step to having that accurate starting point for all users, both in ensuring there's a single record of truth for each item, but also that the data is accurate. Third, focus on automating the data transfer between systems. So we want to be able to provide the right data at the right time for all users. So for example, if a new item is added to the material system for a case occurring tomorrow, we want to make sure it gets over to the EHR in time. So the more real time it can get, the better chance you're going to have to reduce errors or delays downstream. Fourth, assign data content ownership to the right team. So, as I mentioned, there's now data that's not traditionally owned by supply chain that we're asking to be maintained in the ERP item master. So you really need a process that's going to include folks from your rev cycle team, from your clinical teams to provide key data points to house in the ERP. And then lastly, kind of tied to the previous couple, but making updates in a timely manner. So again, having that information downstream in time for a procedure is critical. So even before, having that record available and sending it technically across the interface, we need to get all the data gathered as quickly as possible. So establishing, strong communication process and using communication tools to help get input from all those different stakeholders is going to be optimal for getting items in quickly. So I mentioned, a few items specifically that, may not have traditionally been maintained by supply chain, but are key drivers in the EHR. I wanted to highlight a few of these just to let you all know kind of what they're looking for and how they impact that downstream. So from a clinical standpoint, things we may ask our OR stakeholders to get that they rely on. So things like a clinician-friendly description or a GTIN number, can really help support more accurate and efficient documentation to help ensure that they're selecting the correct item in the system. Other things like assigning the correct supplier implant designation or whether a product, has latex can help drive that decision support process I mentioned before for things around patient safety or tracking purposes. EHRs can use that discrete data to alert physicians. And then things like unit of measure and getting that down to the each level is critical to make sure we're driving accurate billing and inventory utilization. And then items of concern to the rev cycle and things that they should weigh in on, whether or not an item is chargeable or not, and then what that appropriate charge code and HCPCS is going to help drive accurate patient billing and reimbursement. So having the item cost then also at the each level is going to drive, what that charge should be. So hopefully using that dynamic charging as costs change to promote both accurate charging, but also that price transparency and help support clinicians and administrators to view, accurate case costing information. So again, all this information is critical, especially to the EHR, but in this integrated world, it's going to require input from stakeholders outside of just supply chain. All right, the next focus area we mentioned was optimizing technology. So I think the first thing to consider, is how do you best leverage those existing technology and existing core systems. So obviously both the EHR and the ERP have likely been massive investments for your organization over the past several years plus. But we often find clients, and most of our work is with clients who are just not leveraging the full capabilities of these systems. So whether it was to get to implementation faster and leverage just those core tools and optimize later, or you've just been live for a long time and haven't kept up with the latest enhancements or functionality. Our first step would be, ensure you're leveraging all the capabilities before investing in some additional bolt-on that'll add complexity to help make use of those systems to support this process. To call out just a few things specifically, from an Infor standpoint, again, kind of focus on things that are going to help drive those downstream clinical and billing processes. The one, contract management. So again, the health record is as good as what's in the ERP. So that's being the source of truth. So the more items that we can have available with the right pricing based on contract, the less opportunity for error downstream. So often when these don't exist, nurses are manually keying these items in or charging based on potentially a vendor invoice that's walking in the room, and we're getting away from those contracted prices quickly. So having that data downstream can be very helpful to keeping that data accurate. Item lifecycle management, help support the tracking of recalls. The EHR has that ability to tie the specific implant to the patient. So in coordination with this tool can help quickly identify affected patients. Clinical bridge, we touched on this briefly, but essentially is providing that standardized HL7 interface and those requirements that are available that can help reduce the implementation time, really get the core data points sent back and forth. There's not the need to have to reinvent the wheel here for every organization. So definitely a helpful tool to accelerate implementation and use those standards. Infor process automation, a broader tool. So looking for use cases to support potentially data management, or in the past, I've worked with a client who took some of those items that were manually keyed in, maybe bill-only items on the EHR side for documentation, extracting that back and helping to kick off the invoice process. So maybe a myriad of things that IPA could be leveraged for. And then true cost, is the opportunity to look at the full cost of care by pulling in data from both systems to, again, really help reduce that variation, standardize care, and reduce costs where possible. And it won't spend much time here, but, EHR, has a lot of capabilities to support this process as well. So electronic preference card, again, really that starting point in that recipe book for an OR procedure, and for inventory management. Barcode scanning, so the ability to support that more efficient documentation. Dynamic pricing, so that we can use just that cost going through a markup table to price rather than having to maintain a separate charge master. Cost transparency, so again, being able to put that cost in front of clinicians to help drive different decisions. And then demand planning, so with scheduling, combining preference cards can help with that more specific inventory planning. So along with your core systems, there are some other existing and emerging technologies that are available that can enhance the clinically integrated supply chain. Just to call it, there's some interesting things going on in the industry. Point of use, RFID. Wouldn't necessarily say these are new, but I think very helpful in the process of use of RFID. Brings that ability for more efficient documentation and accurate billing that can help improve clinician satisfaction and have that more accurate inventory count. Speech recognition, natural language processing, really just, again, efficiency tools on the clinician side. So, speech recognition, not having to be right at the station and keying things in, or NLP, being able to pull from a note, or other more unstructured documentation if items are documented there, and kind of capture that more discreetly to help reduce documentation redundancy. Remote process automation, again, use cases for, removing person out of a repetitive task, essentially helping maintain the data, item master updates, substitutions, reconciling charges, things like that. Predictive analytics and AI, really say is the next step towards personalized medicine in this context. We could help correlate the efficacy of items such as an implant to, patient's history, their diagnosis, different interventions, and take all that data, and the system can, start to make suggestions for patients in the future, what devices to use, what vendors to use that are going to have the most successful outcomes based on past outcomes. And one I think interesting, probably less in practice now, but 3D printing, so the ability to create a device, a tissue, an implant, on the fly, I think really has profound implications on delivering that specific and personalized care intervention for a patient. As it becomes more prolific, maybe less cost prohibitive, could also help organizations to alleviate those external supply chain pressures and reduce costs overall by owning that end-to-end item life cycle. So again, all these technologies offer great opportunity to enhance the clinically integrated supply chain. But going back, really want to make sure you've got those core systems and building blocks in place to be successful. Okay, and the last piece I want to focus on is enabling analytics tools through this data. So, high-level graphic here, actually from HIMSS Analytics, who, if you're not familiar with, provide, industry-leading practice maturity models for healthcare organizations. They've created one around this concept recently, the CSOM, which kind of provides a roadmap for where we should be trying to go as an industry. But I think at a high level, this is trying to show we're taking data from core systems and allowing supply chain clinicians, executives to monitor and make decisions based on real-time data. So from a supply chain standpoint, help with, enable procurement best practices, using real-world evidence and outcomes to shift that procurement behavior, maybe pressure vendors, and drive value overall. And then from a clinical standpoint, enabling a procurement prioritization. So evaluate procurement needs on an individual patient level and prioritize solutions more based on outcomes. I think one great example, coming out of the pandemic, maybe one positive, a lot of tools in the space were accelerated to help bring in clinical data, inventory data, and outside data into a single place, to maybe predict where the next outbreak was going to happen or where to divert resources, especially with limited supply. So these supply chain metrics became much more of a focus at that executive level. I think they're continuing to see value in this type of data. I think some additional areas specifically where we're seeing that value from bringing this data together. So surgical case costing, the ability to compare the cost of a procedure across different surgeons or across different locations and identify where variance exists. Does the procedure take longer? Are they using or wasting more supplies? Are they using similar supplies and implants to others, but it's twice as expensive? It's all valuable information when looking to reduce variation, both to reduce cost and improve outcomes. Demand planning, so allowing for more proactive inventory planning by monitoring the OR schedule and having that accurate preference card, or identifying, if there's going to be a patient-specific need coming up. And having this kind of insight, ahead of time can really help potentially reduce your stock on hand if you've got far enough out insight, improve the time to deliver, and then ultimately ensure the case, is going to start on time and happen, and that a patient procedure is not impacted due to a missing item. And then lastly, this data can really help to improve surgical quality tracking of outcomes. So based on the implants used, seeing how those might affect readmission rates, surgical site infection, hospital-acquired infection, the need for additional care, et cetera. So, imagine you could say, again, supportive of data that, a lower cost implant vendor provides better outcomes than another. It'd be a valuable tool in the value analysis process. It could also provide opportunities for supply chain to help negotiate contracts with suppliers and potentially engage in more of a risk share model based on patient outcomes. So again, all these use cases we're seeing help organizations just enable better patient care, control costs, and capture revenue. All right, so where do we go from here? I've given an overview on the clinically integrated supply chain and hopefully insight into how the ERP impacts downstream workflows in the EHR and some things you can do to address it. So now, what are some things you can do to get started? From a timing standpoint, I think a lot of catalysts going on in the industry to help start incorporating this type of assessment and integration. One, ERP migrations to the cloud, or new EHR implementations as well. Really a lot of work goes into these projects, which provide a great opportunity to kind of start over and get the right stakeholders involved early to address any issues that you had in your previous integration, and really, don't start from scratch. Rebuild and look at those workflows and look at the optimal way moving forward. A lot of M&A activity going on in the market and affiliations. So, that forces organizations to consolidate platforms and kick off those new implementations, or, integrate with those existing legacy systems. And then you're adding, additional complexities into the host system. So potentially multiple item masters, differing GLs. So again, an opportunity to think through what's the best process versus replicating an old bad process. And then lastly, I think all organizations, have an optimization roadmap, and hopefully have been able to highlight that there is ROI that can be found, and making even small tweaks, in this space can positively impact revenue and clinician satisfaction to where you can prioritize this in your optimization strategy. So what are some things you can do to get started? First, assess that current state of your integration. So again, look beyond the technology, look at the people and the process, and identify those gaps in best practice. Get input from all the different stakeholders that we've mentioned, and look at that end-to-end workflow. And then bring all those teams together and establish that governance. Set those key metrics and goals. Prioritize where the biggest needs are, and get some accountability from the different groups to have ownership in this process. All right, with that, I'll wrap things up just with a couple of key takeaways. So as you think back, if you think back to this presentation, just a few key things to think about. I think what we're saying is hospitals really, need to look at supply chain as a strategic asset. So again, more than just purchasing and delivering an item to the right place, they really are a critical cog in the wheel to ensure quality care delivery, and they can help drive revenue in the organization. I've said this multiple times, but I think bears repeating again. Break down the silos in your organization and approach EHR and ERP integration as more than just a technical connection. You've got to get these different groups engaged and looking at that end-to-end workflow and upstream and downstream impacts to identify where these opportunities are. And then lastly, the time to act is now. Patient safety, revenue loss, clinician and patient satisfaction, and overall hospital margins are all at stake. So the longer that you wait to address, not only are you continuing to experience these challenges, but you're also going to continue to miss out on that ROI that's available. So with that, I will take a breath and I will open it up to any questions that the group has.
So there's nothing in the chat now, but if anybody does have a question, please feel free to drop it in or take yourself off mute.
Well, it looks like we don't have any questions. Okay, go ahead.
No, I was gonna say, this is Karen Terry. I am with Infor, just on full disclosure to everybody here, and this is sort of an informational question for me. I sit on the alliance organization side of the business. Of the group that's on here, I mean, I think to one of the earlier points, how many of you view your supply chain as a strategic part of your business? Is that, do you feel like your organization kind of looks at supply chain as a commodity part of the business, or is it really, kind of the heart and strategic part of your organization? Quiet group.
Very quiet group.
This is Erica Hoffman from Wellspan. I think that view has changed, especially with COVID. From us being, kind of a sideline, all we do is, move and provide product, to being a key indicator and a key player in keeping the hospital supplied.
Any other thoughts from folks on the call? I know as a former clinician, and it's been a while since I've been in clinical practice, I was an emergency medicine trauma nurse. the supply chain was, where we got the stuff, right? And I'll be honest, as a practitioner, I didn't really think about it unless I didn't have it. Certainly as I ascended into leadership within healthcare entities and, then moving outside the business, the direct care delivery business, have a much greater appreciation. I think the impact on COVID is you're spot on there. I think it's made us look at that differently.
Okay, any other questions? Well, Jason, thank you very much for presenting, and thank you all for joining the presentation today. All right, so if you have any interest, next Friday, we'll have another session at 1 o'clock Eastern. It's called Infor SCM Vendor Returns. The presenters will be George Jones and Jerry McGinley from Bales. And as a closing thought, we have an offering called Coffee with Consultants. We want you to be aware of our Coffee Consultant offering. If you have any questions about what you saw today or any questions related to the Infor products, please reach out to us via our website. We will connect you with a consultant who will spend a half hour with you at no charge. So again, if there's something you'd like to discuss Infor related, reach out to our website and we will have a consultant book a half hour time to discuss your needs. So with that, thank you all for joining, and hopefully we'll see you next week. Have a good day.
Yeah. Thank you, everyone.
Thank you, Jason.